If you're suffering from an enlarged prostate, we have a minimally invasive procedure that can relieve your symptoms. This is called prostatic artery embolization. This is a procedure done with X-ray guidance to get a small catheter into the artery supplying the blood to the prostate. We inject very small microparticles that go into the prostate, shut off its blood supply, and then over time, the prostate will shrink and relieve your symptoms. In studies, this is shown to be equally as effective to certain surgeries without any of the side effects. Because this procedure doesn't require any incisions into the prostate, there's minimal risk of causing nerve damage or other sorts of complications that may arise with traditional surgery. Prostate artery embolization is done through a small catheter that's generally placed in the hip artery or the wrist artery, and using X-ray guidance, we get a small catheter into the artery supplying the prostate to inject these particles. This is an outpatient procedure. It generally takes about 2 hours, and you go home about 2 hours after the procedure. There is minimal downtime because there are no incisions, and everything is done through a small catheter that is removed after the procedure. In general, no catheter is required to be placed into the urethra or into the bladder, meaning you do not need to have a Foley catheter after this procedure. With prostate artery embolization, there's minimal side effects and complications compared to traditional surgery. Please call our office to discuss prostate artery embolization.